A huge topic, one that's absolutely crucial to effective trauma-informed care, and one of my absolute favourites is childhood attachment. But what is childhood attachment? As this is such a big topic, we've created a whole video series on childhood attachment. This is video 1 in our Childhood Attachment Explained video series. Attachment is the term used to refer to the psychological connectedness between human beings. Attachment theory was developed by John Bowlby. He was a psychologist and psychoanalyst, and he started to develop the theory in the 1950s.
Attachment refers to the psychological connectedness between human beings. Bowlby proposed that attachment starts from childhood, with a relationship between the main carer, who is often the parent, and the baby. The parent provides for the baby, protecting them and giving them everything they need to grow. In doing this, they provide safety and security, and the baby starts to feel safe and secure.
Attachment is far more than the relationship between two people. It's about that psychological connectedness that means we feel loved, we feel wanted, we feel safe and secure, even when the people that we're connected to aren't present.
Because attachment is about this connection, secure attachments are most likely formed with those who respond accurately to the baby's signals, and not necessarily those they spend the most time with. For example, a child is more likely to form a secure attachment with a parent or carer who consistently meets their core needs. Needs for things like food, warmth, comfort and interaction. These consistent interactions help the child feel safe. They let them know the parent or carer can be relied on, and within these interactions, they start to feel secure.
Attachment itself is all about our connection with others and how secure we feel that they can and will meet our needs. That's all of our needs, our physical needs, our emotional needs, and our psychological needs. It's fundamentally about what we need to feel safe and secure.
An important factor in attachment is that attachments are fundamentally there to enhance our chances of survival. We attach to others to help us survive. A baby couldn't survive on its own. All babies need parents or carers to provide for their core needs. From day one, when a baby is born, they'll start to learn that they need other people to gain access to things like food, warmth, comfort and love. They will cry to get their core needs met, and if the things they need are provided, they start to trust that the adult providing them will meet their needs. This is the start of attachments being formed, where the baby starts to attach to the person providing for them and meeting their needs.
Something we need to remember is that attachments are adaptive. They're there to increase our chances of survival. And even a baby will adapt to increase its chances of survival if its needs are not being met. This is where attachment becomes a little bit more in-depth. If needs are not met or not met consistently, babies, children and adults will adjust their presentation to increase their chances of survival. This is where the different types of attachment come from in childhood. Babies and children will adjust their presentation to increase their chances of survival, and in this we can see different attachment styles.
Bowlby's research started to explore attachment styles. An attachment style refers to a pattern of how a person behaves in relationships. For a child, this is usually how they interact with a primary carer or someone they're looking to for support. Bowlby proposed that these patterns develop in early childhood from the early attachment interactions between the primary carer and the child. Secure attachment patterns indicate that a child has developed a psychological connectedness with another person where they feel safe and secure in that relationship. There are, however, other attachment patterns that can develop that indicate a child feels insecure. The child's behaviour when interacting with the primary carer has adapted to increase their chances of survival. This behaviour will have adapted based on the responses they receive from the primary carer to ensure the child can and will survive. It's all about safety and survival and how the child's interactions develop to ensure their needs are met and that they are safe and they survive. This feeds into how secure they feel and the attachment style they develop.
There are 4 different attachment styles. I go into these in depth in different videos, so if you want to know more, keep watching our Childhood Attachment Explained series. But for now, let's get back to the fundamentals of attachment.
Bowlby proposed that these early connections in childhood, essentially how our needs are met, how we respond, and how secure we feel in those connections, lay the foundations for all future relationships as we grow. These early connections develop into attachments, and how we attach to others then determines what we expect from relationships and how we act within relationships in the future.
So why is attachment important?
Childhood attachment matters because secure attachments, the one we want all our children to have, are strongly linked to various aspects of childhood development. This includes things like emotional regulation. It's well known that securely attached children are better able to manage emotions and cope with stress. Social development. Attachment influences how a child interacts with their peers, teachers, and later with romantic partners as well. Attachment is really important for those ongoing social interactions. Cognitive growth. A strong attachment foundation supports curiosity, learning, and problem solving. It also gives children the confidence to go out into the world and explore. And mental health. Secure attachment is linked to lower risks of anxiety, depression, behavioural challenges, and overall improved well-being. Attachment really does matter, but for many children that we support, they haven't had the opportunity to form secure attachments.
Children who've experienced early trauma are more likely to have attachment-related difficulties. This is why it's important to have some understanding of childhood attachment if you're parenting or supporting a child who has experienced that early life trauma. It can really help you navigate how to support them and how to support them to repair if they have insecure attachments. Understanding childhood attachment really is fundamental to trauma-informed care. So on that note, here's one final trauma-informed care top tip. As I said at the start of this video, childhood attachment is an in-depth topic. It's also a topic that lots of people find a little bit scary. They're worried about getting it wrong. But it doesn't have to be scary. Attachment can be fairly simple to understand if you break it down. It can also really help us understand our children's emotional, psychological, and behavioural needs and provide better overall care for them. So understanding it can be really important. Within our video series on childhood attachment, I've broken everything down to make it as simple as possible. So my top tip today is if you want to know more about childhood attachment, or you think that you're supporting a child who's got attachment difficulties, check out that video series. The more you can understand, the better you'll be equipped to provide attachment-based and trauma-informed care for them. So check out the series, and remember, subscribe to Tribe for more trauma-informed care in practice.